You're listening to the Quint podcast.
How can social and physical isolation impact our mental health? As mental health experts have warned from the very start of the pandemic, a lack of communication with friends and family, losing social ties, physical distancing, isolation, all of the new norms of surviving today is coming at a huge psychological cost. In India, where conversations on mental health still remain tight-lipped to a large extent, Amitabh Bachchan, who's been admitted to Mumbai's Nanavati hospital since 11 July after he was tested positive for the novel coronavirus, opened up about his struggle with his mental health during quarantine. In his personal blog, he opened up about how it feels to not see another human for weeks because of the isolation. He wrote, quote, "There's one note of matter that seems trivial, but it's a factor: the mental conditions and the effects of the disease. Clinically, medically, all that is known to be effective, yet very little is known that remains hidden, unseen and not visible. Matters of the mind often are not. The mental state sparks from the stark reality that the COVID-19 patient put in hospitalised isolation never gets to see another human for weeks." End quote. While different people react differently to testing positive and the isolation period that follows, loneliness, fear and anxiety are something that a lot of people are struggling to cope with as they remain cooped up in either hospitals or in their residences. It's imperative then to understand how can people help themselves mentally during isolation and what can isolation mean for them. In this podcast, you'll hear from Dr. Kamna Chibber, clinical psychologist from Fortis Hospital in Delhi NCR, and Dr. Nikita Sule, who's a clinical psychologist at Jagjeevan Hospital in Mumbai. You're tuned in to The Big Story, the podcast where we dissect the headline-making news for you. And I'm your host, Shorburi. From adjusting to new norms overnight to a complete overhauling of the old routine, this ongoing pandemic has been stressful in many ways. But the biggest challenge has been, of course, the indefinite physical distancing. For the medical staff and the COVID-positive patients that they're treating, unfortunately, physical distancing goes to an extreme. As Amitabh Bachchan writes in his blog, it could mean going without seeing a human face for weeks. And while all eyes are on the physical ailments, a mental crisis is often brewing quietly. How significant can the impact of physical isolation be amongst patients? Dr. Kamna Chibber talks about how isolation can take us in a downward spiral and why it needs to be acknowledged.
So, isolation, loneliness experience करना because of the quarantine pandemic, अब especially आपको diagnose हुआ है कोविड एंड इस वजह से आपको अपने आप को आइसोलेट करना पड़ रहा है, तो उसमें फिजिकली लोगों को ना मिल पाना, कांटेक्ट कम होना, उसका बहुत ज्यादा सिग्निफिकेंट इम्पैक्ट फॉर श्योर होता है. उसमें कोई डाउट नहीं है. रिसर्च हैज कंसिस्टेंटली शोन कि जब लोग आइसोलेटेड होते हैं तो उनके मूड्स पे इम्पैक्ट आता है, लो फील करना, सैड फील करना, चीजों में इंटरेस्ट कम हो जाना, इतना ज्यादा मजा ना आना, प्लस साथ में इतनी अनसर्टेनिटी है, लोगों को पता भी नहीं है कि इसमें आउटकम्स कैसे रहेंगे फ्यूचर में जाके. सो ऑल ऑफ दैट ऑल्सो टेंड्स टू इम्पैक्ट एंड क्रिएट्स अ लॉट ऑफ एंजाइटी एज वेल, एंड इट कैन हैव अ सिग्निफिकेंट कॉन्सिक्वेंस ऑन एन इंडिविजुअल्स मेंटल हेल्थ, स्पेशली इफ दे आर ऑल्सो नॉट बीइंग एबल टू कनेक्ट टू पीपल अराउंड देम. बिकॉज वेन यू हैव अ सपोर्ट सिस्टम अराउंड यू, समवेयर जो आपके दिमाग में जो नेगेटिव थॉट्स आ रहे होते हैं, जो डिफिकल्ट इमोशंस जनरेट हो रहे होते हैं आपके अंदर, वो जो कॉन्वर्सेशन आप लोगों के साथ कर पाते हैं, वो उन थॉट्स को, उन फीलिंग्स को मीडिएट करने में बहुत मदद करता है. And when you are in a state of isolation, then you don't have those breaks available which could help you overcome the negativity which may be surrounding you in that time period. So the fact is कि क्योंकि आपके पास आपको वो मेंटल ब्रेक्स नहीं मिल रहे हैं, अब लोग आपके आसपास नहीं हैं, वो आपको रीअश्योरेंस नहीं दे पा रहे हैं, आपके थॉट्स में मीडिएट नहीं कर पा रहे हैं, तो आप अपनी सोच के अंदर और ज्यादा डूब सकते हैं, विच कुड लीड टू अ लॉट ऑफ इरेशनल और इलॉजिकल थॉट प्रोसेसेस, मेकिंग यू फील दैट you're going into a further downward spiral.
Dr. Nikita Sule, who counsels patients and medical staff at Jagjeevan Hospital, which is a COVID hospital, also talks about how getting diagnosed with COVID-19 can sometimes trigger extreme thoughts.
So whichever patient gets admitted in the hospital, we make sure that we give them one phone call, and we are sure that they're not, suffering from any kind of mental health conditions. And if at all, we make sure we counsel them on the phone, and then we refer them to the psychologist on duty, so they go and visit them personally as well. So when someone gets diagnosed with COVID, along with physical symptoms, there are a range of emotions that a person goes through. There is obviously a lot of anxiety. People start getting fearful reactions that, how did they get it and what will happen to their life now? Are they going to live? They're going to die? Such extreme thoughts keep coming. There's a lot of guilt that a person experiences because once this person is admitted here, the building gets sealed, the family gets quarantined. So they feel responsible for all of this.
Besides the lack of conversations and words, why is not seeing a human face in isolation so impactful on our mental health? That's another thing that Mr. Bachchan highlights from his personal experience. And I'm again reading a few lines from his personal blog. Quote, "There are nurses and doctors on visit and medical care, but they ever appear in PPE units. You never get to know who they are, what their features are, or their expressions because they're forever covered in the units for protection. All white beings about, almost robotic in their presence. They deliver what is prescribed and leave. Leave because longer stay has the fear of contamination." End quote. Talking on that point, Dr. Chibber says that reading human expressions contribute a lot to our interaction with people, and the lack of social cues in isolation can compromise with the mental well-being.
And the other thing is कि जब आपको किसी का face नहीं दिख रहा है, you're also not being able to derive your regular social cues. हम काफी सारी चीजें infer करते हैं from people's expressions, besides what words they may use. And so when people are just coming in and going out, you can't see expressions on their faces. You're not being able to make out, what they may be thinking because you're not being able to make out those expressions, which contribute about 70 to 80% of our communication. That in itself can be very, very anxiety producing for a lot of people. So वो भी एक फैक्टर है जो लोगों की मेंटल हेल्थ को, उनके वेलबींग को कॉम्प्रोमाइज कर सकता है, एंड क्रिएट्स अ लॉट मोर थॉट प्रोसेस. पता नहीं क्या चल रहा है, मुझे सारी इन्फॉर्मेशन मिल रही है, नहीं मिल रही है, मैं कैसे मैनेज करूं. सो a lot of positive self-talk is needed. You have to keep on becoming your own source of reassurance, reminding yourself that, I'm being taken care of. I need to stay positive, maintain my optimism, keep doing the things जो मुझे advice की जा रही हैं, keep taking the medications, do the entire course. Make sure कि जितना हम अपनी तरफ से कर सकते हैं उस situation में हम करते जा रहे हैं, and that would certainly be helpful.
But it's not just patients alone who are facing this mental health crisis in isolation. Remember, doctors, nurses, attendants, and other medical staff who are caring for patients right now too have to isolate themselves from their families for months at a stretch. So, other than taking professional help like the kind that Dr. Sule provides to patients and medical staff, how can people keep themselves mentally healthy in isolation? Dr. Chibber advises that patients must try to stay connected with their social circles as far as possible.
So our suggestion to people a lot of times during this time period is that you must try to stay connected as far as possible with your social network. Try to keep yourself as engaged as you can, even though you may be struggling at this point in time. जो activities जितना आप कर सकते हैं, जितनी हद तक कर सकते हैं उसको करना बहुत जरूरी है. जो भी आप रिलैक्स्ड वे में मैनेज कर सकते हैं वो बहुत जरूरी है, because that will allow you to maintain your mental health, your well-being. Something as simple as, even if you can't read, you can't watch something as simple as even listening to music could be very helpful, क्योंकि वो भी आपके thought processes में breaks देता है, वो आपको distract करता है, आपके thoughts को continuously नहीं चलने देता है. So even that would be very helpful. And so it's very, very important that we focus on this aspect of the loneliness, which could be affecting people who are already diagnosed with the illness.
If you like listening to this episode, please subscribe to the Big Story playlist for episodic updates. We're live on Apple, Google Podcast, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website and check out the podcast section. For any feedback, shoot an email to podcasts@thequint.com.
Thanks for listening. Log on to the Quint's website and check out our other podcasts.